Bone and Joint Week is an opportunity for us at Austin Health to make a real impact for patients needing major orthopaedic surgery and try and catch up in work that has been somewhat challenging over the last couple of years with COVID's impact. The goal for this week is to get as much major joint surgery done as efficiently as we possibly can. It's also an opportunity for us to test new strategies to get better coordination between various treating teams and really bring everyone on a journey to try and provide excellent care for these patients.
This year we're looking to treat more patients. They won't all be joint patients. We'll have more spinal cases this year who've been waiting quite a while for their surgery. Everybody has really brought into the week. It's quite a buzz around the week because people have got a clear goal in terms of we want to treat more than 60 patients. What we learned from last year was we could actually get more patients on some of the surgeons' lists, so that's what we're doing this year. That's a bit different. This year we have ordered less in, which has made some of the load on some of our services a lot lighter.
We have 2 robots now. We normally have 1 here at the surgical centre. We've had a second this year. The robot allows us to template accurately the size of the implant that each patient's going to require and predetermine the alignment. So that allows us to achieve small equipment trays. That allows us to deliver that surgery with precision that's of a greater degree than what we could previously. And then thirdly, it allows us to measure and compare outcomes based on the achievement and the alignment that we've achieved for each patient.
Here in CSSD, our job is to reprocess all reusable medical devices, which means we wash, pack and sterilise. Lots of equipment is coming in for Bone Week. The volume used is probably going to be in excess of 400 trays as opposed to around 50 to 60 trays a week normally.
The planning for Bone and Joint Week has been ongoing. The Enhanced Recovery Programme allows us to effectively get as many patients in the week as possible. Just over half of all our patients are ERP. In the future, we were hoping that we can make all patients ERP, and that's an ongoing project. It's extremely important to collaborate between the multidisciplinary team. There are OTs, physios, speech and language, and dietitians that are all involved.
I think we should really celebrate the wonderful efforts of all team members that have come together. None of us work in isolation in our clinical practice, and to really give these patients the best possible outcomes and experience here at Austin Health, it's so crucial that all of our teams, medical, nursing, allied health and the admin support teams come together to make this all work.
It's not about me, it's about my team, and collaboration and teamwork is extremely important. We need to be able to help each other, support each other at any time, but particularly when it's busy like this for Bone Week.
It's a massive team effort, and if we weren't such a great team, it wouldn't work.
So I cannot thank all the teams, and to list everybody would actually be impossible. Together we can achieve, and that came through very strongly.
We're so grateful. Thank you for your efforts. It's just wonderful.